Hello, my name is Vince Chowdhury, and in this session we're going to talk about pelvic splints in paediatric trauma. We're going to look at the indications for a pelvic splint, describe how to put on the splint we use in our department, and finally some thoughts on imaging the pelvis. Pelvic fractures are less common than in adults. They are also not associated with high mortality from pelvic hemorrhage. Saying that, they do account for up to 3% of fractures in children. The purpose of the splint is to bring a fractured, displaced pelvis into normal position, thus tamponading and closing retroperitoneal space, reducing the volume for hemorrhage, and stopping unstable bones causing pain or worsening damage. Pelvic fracture, and therefore pelvic splint application, should be considered on mechanism of injury. I would say that anyone with hypotension after blunt trauma should be assumed to have a pelvic fracture and a binder applied. If the patient is conscious and able to complain of pain in the pelvis, lower back or hips, consider an unstable pelvic injury. Bruising and swelling around the pelvis and shortened or rotated legs could indicate a pelvic fracture. Do not stress the pelvis to assess for fracture. This tends to displace clots and worsens hemorrhage. Light palpation is all that is necessary. The patient may already have a splint in place on arrival in the department. Do not automatically take it off. We use the Prometheus pelvic splint as it can be trimmed so one size fits all. Firstly, open the pack. The neoprene band will be folded in 4. Open it out until it's folded in half, yellow side outwards. Locate the greater trochanter and align the middle of the band with it. Take the top part of the belt and unfold it in an L shape down the side of the patient's leg. Rolling the patient to one side about 15 degrees past the band under the patient to the midline. Roll 15 degrees in the opposite direction and pull the band through. Again, make sure the midline of the band lines up with the greater trochanter. Fold one half of the belt up and attach the blue triangular anchor with its mark over the greater trochanter. Trim the belt where indicated if access to the groin is needed. Then repeat the process on the other side. Ensure the buckle is central and apply tension to the 2 blue tapes until enough force has been applied to stabilise the pelvis. Finally, secure the blue tapes to the neoprene band to maintain the desired tension and record the time of application.